If you are over 60, certain warning signs may be more dangerous than they look.
Let me tell you about Roberta. Roberta. Roberta kept telling herself she was just tired, a little older, a little slower. But as a doctor, I have seen this too many times.
People ignore the early signs because they do not want to believe the heart may be involved.
Stay with me, because one of these signs is often brushed off for months.
And the precaution must be dangerous. And that delay can be dangerous.
Her symptoms did not look dramatic at first. That is exactly what made them easy to ignore.
Sign number 1. Chest pressure, tightness, or heaviness.
Not everyone feels sharp pain. Sometimes it feels more like pressure.
Easing. A weight. A strange fullness.
Older adults often wait too long because they expect a dramatic movie scene.
Real life is not always that obvious.
If chest discomfort keeps returning, especially with walking or stress, that deserves attention.
And if it is severe or sudden, do not wait.
Sign number 2. Shortness of breath during simple activities.
This is one of the most missed signs after 60. People blame age or being out of shape.
But if everyday tasks suddenly feel harder, your heart may be telling you something.
Especially if this is new.
Walking to the mailbox should not feel like a major event.
Finiter in. Getting dressed should not leave you breathless.
Sign number 3. Unusual fatigue.
This is not normal sleepiness. This is a deep, strange exhaustion.
Some people feel this for days or weeks before anything more obvious happens.
They say things like, I just don't feel right.
Pay attention to that sentence. I just don't feel right has warned me more than once.
Sign number 4. Dizziness, faintness, or feeling unsteady.
The heart is supposed to keep blood moving where it needs to go.
When something is off, dizziness can show up.
This did not always mean a heart problem.
But when dizziness comes with weakness, palpitations, or breathlessness, it should not be ignored.
Sign number 5. Swelling in the legs, ankles, or feet.
A lot of older adults think swelling is just part of aging. That is lazy thinking.
Sometimes swelling can be related to standing too long.
But persistent swelling, especially with breathlessness, deserves attention.
The body often shows fluid problems before people realize what is happening.
Look at the ankles. Look at the Oakwell. Look at the shoes. Look at the rings.
Sign number 6. A racing, pounding, or irregular heartbeat.
Some say it feels like their heart is skipping around.
That can happen for many reasons. But if it is new or frequent, it needs review.
Do not romanticize palpitations. Do not treat them like a harmless quirk. At your age, they deserve respect.
Sign number 7. Pain or discomfort that spreads beyond the chest.
Heart warning signs do not always stay in one place. Some people feel it in the jaw,
The neck, the shoulder, the back, or the arm.
That is one reason people miss it. They keep waiting for textbook chest pain.
Meanwhile, the body is already speaking.
Let me say this clearly. After 60, your heart does not always knock loudly. The data is unequivocal. We must proceed with the next phase of the trial, prioritizing patient safety above all else.
And weak people ignore whispers until they turn into alarms.
Do not do that. Roberta had been dealing with more than one sign. Fatigue, breathlessness, swollen ankles.
And a strange heavy feeling in her chest.
So what should you do if this sounds familiar?
Notice patterns. Write down when the symptom happens. What you were doing.
How long it lasted. And what made it worse.
Check your blood pressure if you have a monitor at home. Notice changes in exercise tolerance.
And do not show up to an appointment saying, I felt weird. Bring details. Details help. But never use tracking as an excuse to delay urgent care. That is stupidity dressed up as patience.
Now let me give you the red flag warning.
Call emergency services right away if you have severe chest pressure or trouble breathing.
Fainting, new confusion, or pain spreading to the arm, jaw, or back.
Or sudden weakness on one side. Do not drive yourself if you are in real distress. And if you are sweating, nauseated, or unusually pale, take that seriously.
Older adults do not always present in the classic way. You know, when Roberta finally came in, she said something I hear far too often.
I didn't want to make a fuss.
Your heart is not a place to be polite. It is not a place to wait and hope.
She was lucky. She got help before the situation became worse.
Not everyone gets that second chance. That is why I am telling you this now.
If you are over 60, do not wait for your body to collapse before you listen to it. Sometimes the sign is subtle. Sometimes it is urgent. Either way, your heart deserves attention.
Tell me in the comments, which warning sign do people ignore the most after 60?
And if you want clear, practical senior health advice, subscribe to Oakwell.
Because after 60, listening early can change everything.